Hi, Bill. My name is Shannon. I am a nurse practitioner student at US University, and I'm going to be doing a head, ears, eyes, nose, and throat exam on you. Are you okay if I upload this on YouTube as an unlisted video for my teacher to grade?
Yes.
All right, thank you so much for consenting. I'm going to go ahead and wash my hands and get everything ready for right now. First, we'll just kind of start off with an assessment. I will be assessing your head and your hair. I'll be assessing the distribution of your hair, the texture of your hair. I'll also be assessing the contour of your skull. I'll be assessing your head, the symmetry of your face, the shape of your head. I'll be assessing for any kind of rashes, lesions, or anything abnormal on your head. I will also be assessing for any depressions or any masses or anything like that. I will go ahead and palpate your head. So I'm going to start palpating your head, and I'm also going to be assessing for any depressions, your occipital bones, any kind of masses or protuberance. Alrighty. And then I'll go ahead and assess for your temporal pulses. Nails feel good. And then I'll come down to your TMJ and go ahead and open your and close your mouth. And I'm assessing for any clicking or any pain. Is there any pain with that?
No.
Alrighty. And his hair looks good, and his head is looking symmetrical with no masses or protuberances or depressions. And so now I will be assessing his eyes. So we will start with the vision test with the Sneller chart. In this chart, I would normally be standing 6 feet away from you, but for the sake of this video, I'm just going to be standing right here. If this was on the wall, a chart on the wall, you'd be standing 20 feet from this. So I will go ahead and have you cover one eye and read the bottom line.
LTFPH.
Go ahead and cover the other eye and read the bottom line.
LTFPH.
And then both eyes open.
LTFPH.
All right, awesome. So here's 20/20 vision. And I will go ahead and move on to the assessment of the eyes. We will be doing the peripheral vision tests as well. So I'll have you cover one eye, and then you can tell me when you can see my hand, okay?
Okay, now.
Alrighty, cover the other eye. Tell me when you can see my hands, my fingers.
Now.
Good, and then we'll do both eyes.
Now.
And other side. Alright, his peripheral visions are well and good. I'm going to go ahead and start assessing his eyes. So I'm going to assess the sclera of his eyes to make sure that they are white, no yellow, no jaundice. I'm going to assess his irises to make sure that they are well-rounded and they have good color. I'm going to assess his cornea and the lens and make sure that they are completely clear and transparent and no cloudiness is there. I'm going to assess his exophthalmos, make sure that there's no protruding of his eyes. I'm also going to assess ptosis, any drooping of his eyelids, and his eyelids to make sure that they completely close. There's no masses or any redness or anything like that. I'm also going to be assessing his pupils, and we are going to assess them with light to make sure that they constrict with light. I'm also going to be assessing direct pupil constriction with light as well as concentric, which means that when I shine a light into his right eye, the left eye will constrict. So we'll go ahead and take out my light, and I will go ahead and assess his right eye. So I'll go ahead and assess the constriction of his right eye. And his right eye constricts, so now I will assess concentric constriction with his left eye, and that is constricting. And we will do the same for the left eye. His left eye is constricting, and now his right eye constricting. And so both eyes are, they constrict with light directly and then also concentrally. Alrighty. And then I will go ahead and move on to the extraocular movement. I am testing cranial nerve 3, 4, and 6. Cranial nerve 3 is gonna, when his eye movement is up and down. Cranial nerve 6 is when his eye moves outward, and cranial nerve 4 is when they move inward. So go ahead and follow my hands and my fingers. So as I'm doing this, I am also assessing for any nystagmus, which is a rapid movement of the eye. And it looks like his eye is moving very well in all directions with no nystagmus. I'm also going to be assessing convergence, and that's when he will watch my finger as I move closer to his nose. So go ahead and follow my finger, moving into his nose. If he hits about 5 to 15 centimeters away, that is within normal limits. And his eyes did converge as I did that. I'm also going to assess for accommodation, and I'm going to have him focus on my finger close up and then to look far away into the distance. And I'm going to watch as his eyes dilate as they look far away. So go ahead and look at my eye close up. Now go ahead and look at the wall behind me. And I'm going to watch for his eyes to dilate, and then go ahead and look at my finger again, and I'm going to watch as his eyes constrict. So that is accommodation. And his eyes did both very well. And we're going to go ahead and move on to the eye exam. So I'm going to go ahead and take my ophthalmoscope. I'm going to turn it on to the setting, and I'm going to dim the lights. And so with this test, I'm going to always assess the right eye with my right hand and the left eye with my left hand. So first, I'm just going to take a look in his eyes. Go ahead and look at me. I'm just going to be assessing again for the corneas and the lenses, making sure they're transparent and not translucent, nothing there, no cloudiness or anything. And so I will go ahead and have him take off his glasses. And then with my right hand, making sure it's at 0, I'm going to follow and making sure that I'm holding the ophthalmoscope in a right position so that I don't jab it into him. So safely. So I'm going to look into this and look for the red reflex. And then I'm going to place my hand above his eyebrow and starting to move forward towards that red reflex. Now what I'm trying to look for here and what I'm seeing right now is the optic disc, which is round and orange. I also am seeing that the edges are clearly defined and the margins are clear. I'm also seeing the white cup, which is a yellow-white color, and the disc to cup ratio is 1 to 3. I'm also looking at the veins. I'm looking for any hemorrhage or escadate. I'm also looking for AV nicking and and the AV ratio of 2 to 4. I'm also looking for any no cotton wool signs. Alrighty, so coming back out. And now we're going to do the same on his left eye, so left hand to left eye. And I'm going to go ahead and look at this till I see the red reflex. Go ahead and look over my shoulder, Bill. So I'm going to place my hand up here for safety. I'm going to follow the red reflex all the way to his eye. I'm also looking at his optic disc. It's orange and round with clear edges, sharp edges. Also, the cup is visible. It's white and visible. And the optic disc to cup ratio is 1 to 3. Also looking at his arteries, and they are, there is no AV nicking, and the AV ratio is 2 to 4. I'm also seeing that it looks like there is no hemorrhage or excavate. So those are all good signs and within normal limits. Alrighty, we're going to move on to the ear test. So first I'm going to be assessing your hearing, which is cranial nerve 8. So I'm going to be assessing the hearing with the whisper test. So first I will be closing one ear and standing about 2 feet behind him, and I'm going to be whispering something that he can repeat after me. So repeat this after me.
Basketball.
Alrighty, and I'm going to cover the other ear and do the same.
Ice cream.
Good. Alrighty, so that was cranial nerve 8. I'm also going to do the Weber test. So this tests the conduction between both ears. So he's going to either feel or hear this. And if he only hears it in one ear, that would be an abnormal finding. So I'm going to go ahead and put it on his head. Tell me, can you hear this in both ears?
I think so. Huh?
Alrighty. So you can hear it in both ears, which meaning conduction is equal on both sides. I'm going to go ahead and do the Rhines test. And this is where I'm going to place this on the mastoid behind the ear. And then this is measuring the air conduction versus the bone conduction. So I'm going to go ahead and place it on the mastoid. Tell me when you cannot hear it anymore.
Okay.
Can you hear that? All right, but that means that the air conduction is greater than the bone conduction, which is good and within normal limits. So I'm going to go ahead and do it on this side. Go ahead and tell me when you can't hear it. Okay. Awesome. So both ears, the air conduction is greater than the bone conduction, which is a good sign. I am now going to assess his external ear. So I'm assessing for any discharge, any redness, any lesions or rashes. I'm going to palpate the external ears, make sure there's no tenderness, no nodules. I'm going to assess the tragus. All right. There's nothing, no nodules, no masses or anything like that. I'm going to go ahead and look inside of his ears with a clean tip. And for safety purposes, I'm going to leave it upside down so that I can have something to kind of help. And I'll kind of have him turn towards the camera so you can see that as I go in, I'm going to be going in this way. So I'm also going to pull on his ear upwards so that it kind of makes the ear canal straighter so I can see. And what I'm going to be looking for is the tympanic membrane. So the tympanic membrane is seen. It's a pearly gray color, and I do see the malleus is noted, and the cone of light on the right side is at 5 o'clock. So that looks great. There's no discharge and nothing abnormal in that ear. So I'm going to go ahead and move to the left ear. I'm also going to keep my ophthalmoscopes in a safe position while I pull up and look at his ear. And I'm also assessing for the tympanic membrane, which is pearly gray. It's not bulging, it's not red, there's no signs of inflammation. Malleus is noted, and the cone of light is at 7 o'clock. And the same was for the right ear. There was no bulging of the tympanic membrane, no redness, no signs of inflammation or discharge, which is great. I'm going to go ahead and change this and put a clean one on. And we're going to move to the nose. So I'm going to assess the nose, the exterior of the nose. I'm going to assess for any, of course, nodules, lesions, or masses, rash, irritated, redness, anything like that. I'm going to palpate his sinuses. So I'm going to start with the maxillary sinus and palpate for tenderness, any tenderness, and then the frontal, no tenderness. And his nose, I'm going to palpate his nose, and that feels good. No nodules, no lesions, no masses. I'm going to go ahead and look inside of his nose. So I'm going to be assessing the mucosa to see what color it is. I'm also going to be assessing the turbinates to see if they are in view. And so I'll go ahead and assess. I'm going to go ahead and have him put his head back and then this up right here. So I'm looking inside of his nose. His mucosa is pink. The turbinates are shown. There's no discharge, there's no drainage, no signs of infection. And I'm going to look in his left nostril. I'm going to also look at the turbinates. There's no polyps, no sinus deviation, septal deviation. The mucosa is also pink. Everything looks great. So I'm going to assess his smelling right now as well. So I am going to have him close one nostril and breathe in and out. And then I'm going to have him smell something. Go ahead and smell this. Can you tell me what that is? Coffee. Awesome. And I'm going to have him do it the same with the other nostrils. Breathe in and out. Okay, go ahead and smell this. Okay, awesome. So his smelling and his breathing is all patent with normal limits. I'm going to go ahead and move towards the mouth. So I'm going to first assess the lips. I'm going to assess for any cracking, dryness, any type of discharge or anything like that. I'm going to have him open his mouth. And now I'm going to assess for the buccal mucosa. I'm going to assess for also any redness, inflammation, anything that looks like an infection, abscesses, cold sores, anything like that. So it looks pink, looks healthy. I'm also going to assess his salivary gland underneath his tongue, and that looks good. I see saliva there. I'm going to assess his teeth. He does not have dentures, but I'm going to assess for dentures. I'm also going to be assessing for any abscesses or anything that could be abnormal, any deformities. I'm going to be assessing his tongue for the size of his tongue and the papillae on his tongue. And that all looks great. I'm going to be assessing for cranial nerve 12 with him by him sticking out his tongue and seeing that there is no tongue deviation. And we're also going to assess for tongue strength. And I'm going to go ahead and place, so we're going to assess for tongue strength. And I'm just going to use the end of this here. Sorry. Go ahead and push up. Okay, tongue strength is good. And that was cranial nerve 12. I'm also going to be assessing his uvula. Go ahead and open your mouth and say ah. All right, so his uvula is pink. It's midline. It's non-inflamed. I'm also going to be assessing the soft palate, the hard palate and the soft palate. So the hard palate is a little bit wider and the soft palate is pink and moist. As he says ah, I'm assessing cranial nerve 9 and 10, and that is when the uvula moves upward when he says ah. So go ahead and say ah one more time. Great. And the uvula does move upward, which means your cranial nerve 9 and 10 are intact. I'm going to be assessing your tonsils and adenoids as well. Go ahead and open your mouth. All right, so his tonsils are +1, and his adenoids are present. So everything looks really good, Bill, in your mouth. I'm going to go ahead and move on to the range of motion of his neck. So we're going to start by having you bend forward and back, and tell me if you can experiencing any pain or decreased range of motion. Go ahead and put side to side. And then we're just going to turn your head left and right. Any decreased range of motion or pain? All right, you're looking great to me. I'm going to assess from, if you can go ahead and try to turn your face towards my hand. Turn your face. I'm going to assess any kind of in his spine. Go ahead and do that again. And it looks like his strength in his spine, it does not cause any pain when he pushes against my hand. I'm also going to have him shrug his shoulders upward as I push down. And that is also very strong. There's no pain or tenderness. I'm also going to take a look at his lymph nodes. So first I'm going to start with the periocular. And just taking 3 fingers, I'm going to just softly palpate the preauricular lymph nodes. And then I'm going to come towards the back of the ears, the postauricular lymph nodes. And then I'm going to come down to the submandibular and the submental. And then we're going to palpate the anterior cervical and the posterior cervical. And then I'm going to palpate the occipital. So when I'm palpating for, and then the supraclavicular, which is right above the clavicle. And I do not palpate. So when I'm trying to palpate for is any kind of inflammation, any nodules that are above pea size, that are non-moving, just anything that's swollen or tender. Was anything tender to you?
No.
Okay, great. So then I'm going to go ahead and also take a look at his trachea. I'm going to go ahead and palpate his trachea. So making sure it's midline, making sure that it is movable. I'm going to go ahead and look at that and palpate that. And then I'm going to take another assessment, and we're going to assess his thyroid gland now. I'm going to have you kind of tilt your chin up and go ahead and just take a look at his neck. There's no inflammation. I don't see any masses, and no goiter is noted. I'm going to be assessing for, just any abnormalities with skin color. And then I'll go ahead and have you swallow. And I'm going to just assess the movement of his thyroid as he swallows. And I did see some movement going up and down around the cartilage, around the cartilage. And so from there, I'm going to go ahead and assess, palpate the lymph nodes or the thyroid, and I'm going to go ahead and the cricoid cartilage is where right below the cricoid cartilage is where you assess the thyroid. So I will go ahead and assess that. I will palpate it, and there's no inflammation or anything noted, no masses. And I'm gonna go ahead and have him swallow for me. And as he swallows, I was feeling for the thyroid to go up and down in between my fingers. So that was very good. Everything appears to be completely with their normal limits and you seem very healthy. So thank you for letting me assess you.
Thank you.